The DuraGen Dural Graft Matrix by Integra Neurosurgery is a unique collagen graft for dural repair. Unlike any other system, the DuraGen Matrix provides immediate closure to prevent CSF leaks and promotes natural dural repair, providing patients with real dura upon healing. DuraGen Matrix is manufactured by Integra Life Sciences, a pioneer in the development and manufacturing of collagen implants and advanced regenerative technologies. Integra developed the Type 1 ultra-pure collagen used in the DuraGen Matrix. This collagen has been used in more than 10 million tissue implants, including skin regeneration, chronic and acute wounds, and bone reconstruction. It is treated by a unique process that removes all non-collagenous components, including potential antigens and any viral and bacterial contaminants. In 30 years of use, there have been no confirmed reports of foreign body reactions or rejections. DuraGen Matrix products have been implanted in over 1 million patients and have the most published clinical support of any collagen-based dural graft. This includes 10 peer-reviewed studies that analyzed results involving more than 1,400 patients from a variety of procedures. These studies showed no foreign body reaction or graft rejection for DuraGen products. CSF leakage rates averaged 2.1% for DuraGen products compared to 7.5%, which was the average found in studies reporting on standard of care in different procedures. Let's take a closer look at the options for dural repair and what makes the DuraGen Matrix a system like no other. For years, the only accepted method of dural closure was watertight suture to directly close the dural margins. A fibrin clot would then form around the closure to keep CSF from leaking. But applying direct suture can be difficult or even impossible if the dura is degraded. Physicians have reported that such situations include older patients with thin, fragile dura, cases where the dura has become dehydrated during long surgeries, when large portions of the dura have been resected, and when there is brain swelling and the dural margins cannot be approximated. Why choose the DuraGen Matrix over other kinds of grafts? First, grafting with the patient's autologous tissue adds additional time and complexity, and harvesting may result in donor site morbidities. Non-autologous grafts that are strong enough for load-bearing sutures may be stiffer and therefore less conformable, allowing spaces to form between the graft and the brain through which CSF could leak. Repairing a damaged dura with the DuraGen Matrix is as easy as placing the graft directly over the defect. Once the graft hydrates, it becomes a pliable membrane that intimately conforms to the complex surface of the brain. It attaches to existing dura via surface tension and fibrin clot formation, eliminating the requirement for sutures. As with any technique for dural repair, a fibrin clot forms almost immediately to seal the dura. What makes the DuraGen Matrix unique is the communicating open pore structure which allows the matrix to rapidly absorb blood and plasma exudate. Another unique feature is Integra's ultra-pure collagen. This Type 1 collagen matrix is an initiator of platelet aggregation and attachment, and therefore an effective initiator of clot formation. Within hours, the fibrin clot creates a strong barrier against CSF leakage. The collagen matrix is now a protective, leak-preventing layer between the brain and overlying structures. Within days after surgery, the dural repair process begins. The pores of the DuraGen Matrix are engineered between 50 and 150 microns, within the optimal size to allow fibroblasts to rapidly enter and begin the dural formation process. Several days after implantation, fibroblasts enter the honeycomb structure of the DuraGen Matrix from surrounding tissues. The interconnected network of large pores provides a scaffold that is similar to the patient's own native collagen and acts as a foundation for the cells to deposit new collagen. The pore distribution is consistent, ensuring that fibroblasts can migrate throughout the entire matrix and distribute collagen uniformly without encapsulating the graft. Vascularization of new tissue follows the initial infiltration of the fibroblasts to form fully functional tissue. Because the DuraGen Matrix is 99.3% porous, the new tissue created by the fibroblasts grows to fill the empty spaces. Within 2 weeks of implantation, a complete tissue membrane is established. The new membrane acts as a permanent barrier to contain the CSF, replacing the fibrin clot, which breaks down during the normal course of wound healing. As the patient's new dura matures, the implanted matrix is completely resorbed. Within 8 to 12 months, the neodura has developed into mature, functional dura for a complete and natural repair.